Hey YouTube, what's going on? Okay, so today's video is going to be on shock, right? So shock is basically your tissues are not being perfused. That means your skin, that means your brain, that means your kidneys, that means your heart, that means your lungs. All these organs are not being perfused. That is shock. So there's different kinds of shock. There is distributive. That's like your septic shock, or anaphylactic, cardiogenic from an MI maybe, hypovolemic shock. You have nausea, vomiting, diarrhea. You have those patients. You have patients that just aren't drinking. You have severe edema. You have ascites. So your liver patients, your elderly patients who aren't eating or drinking, maybe because of an infection. These people need to be monitored for sepsis. We need to be on top of it as nurses, okay? If somebody seems off, then you might be picking up on sepsis. If somebody is like a little agitated, you might be picking up on sepsis, okay? That could be a sign of sepsis, not only infection. I used to think confusion or change in behavior, infection. Also, it could be sepsis because the first stage of sepsis is the compensatory phase, okay? So this phase, your epi, all your catecholamines, your epi is pumping because your blood pressure is dropping. You are not getting the right perfusion. So your body goes into compensation. Your patient's body goes into compensation. Okay, so this is when we need to pick up on it. Don't wait for that low blood pressure. Don't wait for that. So I'm gonna tell you what to look for before it gets to that clinically diagnosed hypotension. Like, do not let it get that far, because at that point that patient is not compensating anymore and they need the ER and then the ICU. Okay, so in this phase, like I said, the epi is pumping, and then because it's fight or flight, it's like my blood pressure is falling, so the epi constricts your blood vessels, brings that blood pressure up. Also, your baroreceptors, your chemoreceptors, they're all picking up on this. Your aldosterone is cranking, and aldosterone is part of the RAS system, right? I already talked about the catecholamines. So in this first stage of shock, their blood pressure is normal. When you see a normal blood pressure, you can't be like, oh, that's great, their blood pressure is normal. Yes, but you have to look at the whole picture. Like, what is this patient at risk for? Do they have pneumonia? Are they vomiting? You know what I mean? Like, because then that normal blood pressure could be indicating shock. So they, like, especially like when you're on the med-surg floor, you're on the ER, make sure you know what's going on with this patient, because in the ER, they're going out for tests and these people are transporting them, right? They take them to the bathroom. You need to know that. Oh, when they come back, say, can you let me know when the patient comes back? Hopefully they can. Or you could say, like, leave me a note, like, let me know what happened, like, while you took them. Did they go to the bathroom? Like, try to know what's going on with your patient, because if they're all of a sudden putting out less urine, that's a compensatory. If they don't have like end-stage renal disease, this is possibly a compensatory mechanism for them going into shock. Okay, so monitor for decreased urine output. So in shock, like I said, it's hypoperfusion to all your tissues. So they are gonna be an anaerobic, like at the cellular level, they're an anaerobic metabolism. So their body is gonna compensate and make ATP without oxygen. So they're gonna have acidosis. So if you happen to have that lab value, if their acidosis, lactic, I think it's lactate, or if their lactic acid is high, that indicates anaerobic metabolism, okay? So look for that if you have those values. If you see symptoms that point to shock, ask for that lab. Their heart rate's going to be high because they are trying to get what blood they can get to the brain, the lungs, the kidneys, the liver. It's trying to get the blood around, okay? So your heart rate's going to be up. And like I said, the epi is pumping, right? So that's fight or flight. They're going to have anxiety. They might have a little bit of anxiety. They might be agitated. And you're like, whoa, what's going on? So look for that little change in behavior and mental status, okay? And if they start being lethargic, then they could be into the next stage. So their blood pressure needs to be checked at that point. Let's see. So the one thing I didn't touch on is the respiratory alkalosis. So when the lactic acid is going up and your body's in metabolic acidosis, the respiratory system kicks in and starts blowing off that CO2. So that's the other sign of the compensatory stage of shock. A high respiratory rate, 22 or up. So then if you have ABGs, you'll see respiratory alkalosis, because that respiratory system is kicking in and it's compensating. Once all of these systems in the body fail and it can't keep up anymore, that's when shock becomes an emergency. So if we catch it in the stage when their body is still somewhat perfused and their heart is still able to pump, this is when we need to get those fluids going. This is when we need to treat. This is what we need to catch. We can't wait for the hypotension. The hypotension at that point is too late. But here they can get their fluids and be monitored close, but maybe it could not end up in death, because sepsis and shock are deadly. Because some people their bodies just can't do it. They can't recover from it. Okay? So this is the compensatory phase. This is when we need to catch it. I recently saw some statistics on sepsis in local hospitals, and they're not good. Nurses and doctors, we are not picking up on sepsis, or there's something we don't know in our treatment that we need to learn, because there's a lot to be understood about a lot of the chemical mediators in septic shock that the immune system produces. I believe there's a lot of research in sepsis and shock. But what we do know is if we catch it early, then the patient's prognosis is better. So there's a lot of improvement for in sepsis shock that need to be addressed. Like, we need to improve in this area. You could do this in long-term care. You can do this in any setting. It's just something we need to be watching and look at this patient and figure out, are they at risk? Are they elderly? Do they have an infection? Is their white count up? You know, have they been having nausea and vomiting? Have they been not drinking because of the nausea and vomiting? Like, that's a patient at risk. And it could happen over days, it could happen rapidly. Especially if you're dealing with trauma. Like, or a GI bleed or something like that. That could happen more rapid. But yeah. So if you guys have questions, or if you like this video, hit like and subscribe. I would really appreciate it. And that is it, guys. I'll talk to you guys soon. Bye.